Hello everyone. Today I am going to perform perineal flushing return demonstration. Perineal flushing involves cleaning of the genital area of the patient for the purpose of removing perineal secretion and odor and prevention of contamination and to promote client comfort. Now, perineal flushing is indicated for patients who are in labor, patient who has perineal repair, and for comatose patient, bedridden patient, and for those who has indwelling catheter. Now, prior to conduct a procedure, I prepared all the materials needed to conserve time and energy. This include a bedpan, kidney basin, 7 cotton balls soaked with cleansing solution, dry cotton balls, working gloves or sterile gloves, perineal pad, a sterile forceps, but assuming that this is a sterile forceps because I don't have here. That this is for demonstration purposes. And a pitcher with warm water. Now, I also have perform medical hand washing to protect my patient and myself as well from infection and cross-contamination. And I am going to introduce myself to my patient, verify my patient identity, and explain the procedure to gain her full consent and her full cooperation. So, good morning, Ma'am. I am Amber Sanchez, and I will be your aide for today. May I see your wristband, Ma'am? Please state your complete name. Okay, Ma'am. Thank you. So, today, we'll be doing the perineal flushing. So, basically, I'm just going to wash your genital area so that you will feel more comfortable and refreshed. Will that be all right? Okay, great. So before we begin, I'm just going to close the door so that no one from outside will be able to disturb us while we're doing the perineal flushing, okay? Now, close the door to provide patient privacy. And after doing that, place the patient in a dorsal recumbent position. These provide a good visualization of the area to be cleansed. Okay, Ma'am, I need you to flex your knees. Okay, I need to lift your buttocks so that I can place a bedpan underneath. I'm going to help you lift your buttocks in the count of 3. Please cooperate. 1, 2, 3. So now, after doing that, I'm going to wear my working gloves and start working with my patient perineal area. Okay, now I'm going to start cleaning. First, expose only the area to be cleansed so as to help the patient avoid having chills and from getting embarrassed. After doing that, I am going to flush a warm water over my patient perineal area. Okay, Ma'am, I am now going to pour a warm water over your perineal area. Okay, so as I was doing that, I am also expecting the perineal area of my patient, noting for any particular areas of swelling, inflammation, excessive discharge, or discharge secretion from the orifice, and the presence of odor. Also, I am using a warm water because warm water will soften and dissolve blood clots if there are any. And also to prevent the the patient from having cheek. Now, I am going to proceed with cleaning the perineum or cleaning my patient genital area. I am going to place my kidney basin in here, and this is where I'm going to discard the used cotton ball. Using my sterile pickup forceps, I am going to pick up a cotton ball and then start cleaning the genital area of my patient, starting midline from the symphysis pubis down to the anus. Okay, ma'am, I'll begin. Okay, then discard the cotton ball. I'm going to pick another one and start cleaning the labia majora from the farther side and start at the mons pubis down to the anus by way of figure 7. And then discard. It is important to remember that as we do this whenever we retrace a stroke so as to prevent contaminating the already cleansed area. I am going to pick another cotton ball and then use it to clean the labia majora of the opposite side. And then discard. Another cotton ball I am going to use to clean the labia minora, starting from the farther side from me and then starting from the mons pubis by way of figure 7 down to the anus, and then discard. Next, I am going to pick up another one and do the same on the other side. Okay, and after doing that, I am going to clean the groin area of my patient. Okay, then discard and do the same on the other side and then discard. After doing that, I am going to flush my patient on genital area with warm water. Okay, ma'am, I am going to pour again warm water over your perineal area. Okay, after doing that, I am going to dry my patient genital area using dry cotton balls. So to do that, I am going to pick up a cotton ball. I am going to do the same stroke as I used for cleaning the genital area. So I'm going to begin in the midline from the symphysis pubis down to the anus and then discard. Next, I'm going to pick another cotton ball and then clean the labia majora by way of figure 7 down to the anus and then discard. And then I'm going to do the same on the other side. And then discard. Then another cotton ball for the labia minora and then discard. And then another cotton ball for the other side and then discard. Then I am going to dry the groin area and then discard. Another cotton ball for the other side, the groin area still, and then discard. Next, I am going to take the bedpan off of my patient buttocks. Okay, ma'am. I am going to help you lift your buttocks again so that I can take off that bedpan beneath. Okay, in the count of 3. Please cooperate. 1, 2, 3. Okay. Now, after doing that, I am going to turn my patient into her left side so that I can also dry her butt cheeks. Okay, ma'am. So I need you to turn your left side so that I can dry your butt cheeks. Okay. I'm going to use another dry cotton ball and then discard, and then another cotton ball to dry the other side. And then discard. Okay, mom, you can lie down on your back again. Like that. And now, since we're done, I'm going to place a perineal pad on your underwear and then let you wear it, okay? Now, we can also spray an antiseptic as needed. And now, I'm going to place a perineal pad on my patient underwear. Perineal pads absorb blood and discharge from the vagina. So now, we're going to put a perineal pad in an up-down motion. Okay, now that I'm done doing that, I'm going to let my patient wear her underwear and short. Okay, mom, so now you can wear your short. Okay, now we're done doing your perineal flushing. How do you feel? Are you much comfortable and are you feeling refreshed? Oh, that's good to hear, mom. Since we're done, I'm going to leave you now and let you have some rest. Okay, so if you need anything, do not hesitate to use the call button so that I can go back here and attend your need. Now, after doing the procedure, I'm going to do aftercare, record, and report. Thank you for watching.